we are live. Can you tell us who you are?
Yeah, my name is Dr. John Witcher, and I've been a medical doctor here in Mississippi for 25 plus years. I'm a general practitioner, emergency room doctor, and hospitalist.
And I'm Brooke Witcher, his wife.
All right. And so we had a couple people come on before this talk about their experiences with you treating them during COVID, but I want to go back to the beginning. Right as COVID was happening, what do you think kind of made your journey look different than some of the more mainstream doctors?
Well, I was the medical director at a small rural hospital here in Mississippi when COVID started. I've treated hundreds of COVID patients, both in the emergency room, hospital setting, in a clinic setting, as well as at home. But when COVID hit, I felt like it was a virus that was genetically modified, gain-of-function research that it probably did come out of the Wuhan lab. And of course, fast forward now, I think many of us are pretty well assured that's the case. And so I was skeptical from day one. I mean, it is something that people, it was an illness that we had never seen before. Like I said, I've been practicing for 25 plus years here in Mississippi. It was a new illness, something that was that I had never seen before, but I was skeptical that it was a bioweapon from day one, really, to be honest.
Okay. And so what are you hearing in the media? What starts happening in your hospital?
Yeah, well, in the hospital, we started treating COVID patients. I think we had a 69-year-old female that was probably one of the first COVID patients in Mississippi. She was very ill. I used the Zelenko protocol. I mean, it was not just him, but it was many doctors at that point. I mean, in the literature, azithromycin, zinc, these medications were, I think many doctors, even here in Mississippi, were using those medications to treat patients, and so was I. And so, quickly, the hospital administration, pharmacist, committees said that we could not use azithromycin or zinc or any of these medications to treat COVID patients, and so, of course, then they started pushing remdesivir at that point.
And just to be clear, Children's Health Defense is not giving any medical advice. This is the experience of our friend here, Dr. Witcher.
Yeah.
And so they start censoring what you can and can't do. Has that ever happened to you before as a medical professional?
Not to that extent. I mean, there's always, when you work in a hospital setting, there's a formulary they want you to use. It's usually based on, cost effectiveness, etc. But not to this extent. It was you're going to follow these protocols that are being presented here, and really, now with electronic health records, as soon as you diagnose the patient with COVID, really the orders were kind of just came out, and the pharmacy committee was kind of overseeing that, and so we really didn't have a choice on what medications these patients were put on.
So you were actually able to treat patients with a certain protocol that was, in your opinion, actually helping.
Yeah.
And then so you saw that cutoff where then things changed.
Absolutely.
So what was happening in the patients after that point?
Well, after that, so you got to keep in mind that I'm in a rural hospital, so we don't have an ICU unit. So patients that, our patients were less ill at this hospital. If they needed an intensive care unit, we transferred them. So my goal early on was to definitely not intubate the patients. We knew, and not just me, but I think it was a general consensus across, many, even the United States, that intubating the patients was not the way to go. I mean, we just saw that most of these patients didn't survive once they were intubated. So, we did everything we could not to intubate the patients.
And have you seen before protocol not working and people continuing to do it?
Protocol not working?
Yes.
And well, I mean, this was just pushed. No, I mean, I've never seen anything. It was a whole lockstep situation, regardless of there was. I mean, it was pushed by the administration, government, etc. And that's just the way it was going to be. These days, most doctors are not independent. They're either employed by the hospital or contracted to the hospital, and so, and I was under a contract. So, really, I mean, you basically do as you're told, or else, you get replaced.
So walking forward into the vaccine gets rolled out.
Yeah.
What did you begin seeing?
Well, I mean, I was, skeptical of the vaccines being rolled out that quickly, and certainly, I mean, I think any doctor that's practiced very long knows that, I mean, that they're skeptical of a new pharmaceutical or the pharmaceutical industry in general. I mean, they have a track record, and so, I was skeptical that a vaccine could be rolled out that quickly, and so, I never ordered a vaccine for a patient, and that put me on the radar because I was the medical director of the hospital, the emergency room, the hospitalist program, and so when the administration wanted me to order these mRNA vaccines for not only employees but for patients, and I refused. I just said, I can't do that because I don't know the risks that are involved, and so that put me on the radar as being not a team player.
And so, because it is a more small rural hospital, were you beginning to see any kinds of injuries from the vaccine?
Yeah, I mean, so when the vaccines started becoming pretty well widespread available early January of 21, yeah, immediately I started seeing vaccine injured patients in the ER. Everything from, heart problems to blood clots to neurological problems. One patient had Guillain-Barré syndrome, and she was diagnosed, and she took one shot of Pfizer. Immediately thereafter, she started developing lower extremity weakness. By the time I saw her a few months later in the ER, and she went to the ER just to get her medications refilled on a weekend, and she couldn't walk at that point. She couldn't even stand up on her own, and so she had told me she had been diagnosed by a local neurologist with Guillain-Barré syndrome after having the vaccine. So, this was this was a definite injury, documented injury, and so yeah, at that point, I had been just wanting to be cautious because, like I said, it's a new medication. We don't know the risk involved, and so certainly after seeing injuries that I felt were direct cause from the vaccines, and then of course this particular patient that I knew was, I was very concerned.
Were you seeing injuries in young people?
Yeah, I saw. Yeah, I mean, I had saw one young person, a female actually, that had developed myocarditis, pericarditis from probably related to the shot. So absolutely. Mm-hmm.
So then we had Carlisle came in here earlier, and he was experiencing some pretty bad issues, and it sounded like you were able to help him out. Can you walk us through? How do people start finding you, and how did you start treating people?
Yeah, I mean, so. We brought Dr. Peter McCullough to town in September 21.
Tell them about Mississippi Against Mandates.
Yeah. Okay. Well, when they formed, why don't you talk a little bit? Tell them about Mississippi Against Mandates.
Well, we were very skeptical of the vaccine, and we had begun seeing, I was hearing his stories, but I was also hearing other people tell me the problems that they were having from this vaccine. And in August of 21. That was at the heat of the whole Delta episode, and we lost 5 friends in 1 month to this protocol, but we didn't really understand the protocol yet. I didn't, and when I lost one very, very dear friend from our church, and they were all in their 50s. These were young, healthy people, and that's when the lid came off for me. And we sat down, and we've never been activist type people except for the Lord, and when this happened, we just prayed about it, and we started Mississippi Against Mandates. And I was upset about the mask mandates. I was upset about the vaccine mandates. I was upset about the hospital protocols that had been forced, and the silencing of doctors, all of it. And we just could not be silent. We just could not be silent, because to be silent is to disobey God. And we just had to stand up. And so we tried to group with other people that were, already in this movement that was new to us. We had just at that time watched Vaxxed, the Del Bigtree production, and we were shocked. We were appalled at what we learned. And so that's when we started, trying to group and trying to motivate others to stand up against these. And because of Johnny's medical background. We wanted to protect other hospital people who also clearly saw the harms that were being done with this vaccine, to not have to be forced to take it. And then students started being forced, and then they started trying to push it on pregnant women. I mean, it just seemed like the gloves were off. And so that's when Johnny made contact with Dr. Peter McCullough, and we organized a big event, and that was in October of 21. And he came out and he spoke to, I don't know, about 500 of us, and there was a lot of physicians that were there incognito, you might say, and on the down low. And we invited all the Congress people. We invited everybody to come. And I'll pass it back to you, honey.
Yeah, so we had a big event, and this was so at this point, everybody was being mandated to get the shots. This was when the federal mandates came out. If you were a federal employee, if you had a federal contract, you were going to get mandated to get the vaccine. So we all grouped together and just went out on the streets. And a lot of these folks were like Brooke was saying, had been in the vaccine injury movement before. Something was totally new to us. I mean, we childhood vaccines. Our children are grown. When they were little, they didn't have that many vaccines, and this was something we just we didn't really know about these vaccine injuries with the other vaccines. So, but anyway, we grouped with a lot of these people, and we were able to get many people exempt from getting the COVID vaccines. At our hospital, for example, hundreds of people were exempt due to religious exemptions, and throughout the state through Mississippi Against Mandates,
and natural immunity.
But many of them didn't get exempt. I mean, they lost their jobs. I was just speaking to a lady that's going to come up next and talk. She's a nurse, and she lost her job, and many folks did. Not only in the healthcare industry, but also at Ingalls Shipbuilding, one of our large industries here in Mississippi, and a lot of military folks, college students, etc., lost their jobs or careers, and so. And that's something we want justice for them. We want our politicians to stand up. These people that lost their military careers, their jobs, their careers, etc. This needs to be looked at.
It absolutely does. So you guys have organized this awesome event, and we're really glad to have you join us.
Yeah, thank you.
And to be here, and I think, like you said, your faith helped you step out and speak up, even if it might have been scary. And I know that must have helped a lot of people.
Yeah.
So in this area, I'm just curious, how many people do you think you've been able to help out when it comes to COVID-19 protocols, hospitals, and the vaccine injuries? You guys got a ballpark?
Yeah, I mean,
it's countless.
Yeah,
It's
we've helped a lot. I mean, I've treated hundreds and hundreds and hundreds of COVID patients and COVID vaccine injured patients, and we help try to get people on off remdesivir and onto the Math Plus protocol.
Tell them what happened when you did that.
And what's that?
And tell them what happened when you took people off remdesivir.
Yeah, I mean, that was, of course, I was already on the radar for speaking out against the COVID vaccines, and then, when the Delta variant had kind of dropped off. If everybody remembers, there for several weeks, we didn't know Omicron was coming. We didn't know any new variant would come, and so we had lost quite a number of friends. And I, and of course, we brought Peter McCullough to town, and then I was doing a lot of research on Paul Merrick and Pierre Corey's Math Plus protocol, and I talked to Dr. Peter McCullough about it. And then we have other doctors in Mississippi, and we're all grouped together. And I just made up my mind, if we had any more COVID patients in the hospital, that I would treat them not with remdesivir, but with this Math Plus protocol. And so that's what I did on early December 21. We had 3 new patients that showed up, probably had the Omicron, but I decided to not give them remdesivir, and put them on things like the Math Plus protocol with ivermectin, for example, vitamin supplements, etc. And I was terminated that day. Of course, I was told that they just didn't need me anymore. They didn't, so that was, but from there it was it was a blessing in disguise. I was able to start treating patients out of the hospital setting, to keep them.
Very night.
to keep them from going to the hospital. And I learned that, this Math Plus protocol or variations of that very much does work on these patients. There's not a silver bullet to treat COVID patients, but the combination of things: steroids, blood thinners, vitamin supplements, ivermectin, hydroxychloroquine, breathing treatments, etc. I treated some very, very critically ill patients at home that I know if they would have went to the hospital, it's very likely they would have been intubated, put on remdesivir, and not made it. And so from just all that, I mean, we were able to network, and like I said, people have come, and I'm treating their injuries, vaccine injuries, treat a lot of long COVID. Long COVID and vaccine injury from the COVID shots are very similar illness, but it's the problem though with the people that have been vaccinated for COVID, their bodies are like, some of them become like a factory producing these spike proteins that are causing the injury, and so they're very difficult to treat, many of them.
He's been on a campaign and joined by many other people in the state to accomplish several goals, and one of the goals is to have these shots pulled off the market until they can be examined and we can do the research and the data, because they know who has had the shot and how long they've lived. If they lived, over 6 months, they know what they died of. We want those things investigated. We want rights for patients, to have their loved ones with them, to have the choice of their care. And, he's worked tirelessly to advocate for these things, but also doctors and nurses and professional people, nobody should be silenced. They passed a amendment in Mississippi. I don't want to say the wrong thing. You want to tell them about that amendment about silencing the doctors?
Well, yeah, I mean, the early on, back about right before we brought Dr. Peter McCullough to town, when we started speaking out against the vaccine, the licensure board here in Mississippi put in their policy that any doctor that gave out misinformation on the COVID vaccines would run the risk of losing their medical license. And so this was something and they sent that out to all the doctors in Mississippi via email. And so this really shut the whole discussion down across the state. And so that was one thing that, last year about this time, I worked hard with some legislators to get that reversed, and we did. We were able to get the medical licensure board to take that out of their policy, and so that was a win. But and then this time last year we brought to our state capitol with Representative Randy Boyd was leading that up, and we brought about 25 speakers there. Dr. Peter McCullough had that. He was leading that, as well as Dr. James Thorpe, Dr. Rennie Moon, Dr. Christine Parks, Dr. Jancy Chung Lindsay, several more. We had Dr. Howard, Jeff Howard here in Mississippi. We had Dr. Carol Hill. We had Ben Marble. We had many folks, several doctors from Louisiana. From Alabama. Dr. Tankersley, Dr. David Cotterwood. And we had 8 vaccine injured there. And Epoch Times did a good...
this was at the Capitol.
At the Capitol building this time last year. And Epoch Times did very good coverage. We had local news coverage, but, they basically just said we were against the vaccine mandates, but we're not. We were against stopping the shots. And also, they reported on none of the vaccine injury testimony. And so that was very upsetting. And that's where we're at today. I ran for governor of last year. Just the main platform was against this whole government tyranny being weaponized during COVID, and really to stop the shots. And so we got over 65,000 people voted for us in Mississippi. So I believe most of those folks were voting for us primarily due to COVID and wanting these shots stopped. And so we're still in that fight. I'm working with legislators now and our current governor, and we're trying to get, like Brooke said, we want at least we'd like to get the governor to sign into law to make our health department evaluate the risk involved with these mRNA COVID shots, and see if there's we want to know what the real numbers are of the vaccine injured here in Mississippi. We know there's some. And the health department's always claimed that these are super duper safe shots, and so we want them to do a study, and in the meantime we want the shots recalled until they can be proven to be safe. And so, and we want our Attorney General to follow suit with Ken Paxton in Texas, who's suing Pfizer. We want to do that here in Mississippi, and you know, we're so happy that Dr. Joseph Ladapo in Florida has come out to halt the shots, and we here in Mississippi we want to do the same thing. And so, and we're, you know, thankful for Children's Health Defense and for Robert Kennedy Jr. coming to Mississippi, and him, you know, we just really believe that, you know, we're praying that, you know, this is going to expose the whole pharmaceutical industry in these COVID vaccines in particular, and that they can be stopped.
Okay, and as we wrap up, I just have 2 quick questions.
Mm-hmm.
One, in your opinion, was the mainstream protocol being used in the United States to treat COVID-19 doing anything to actually help these patients get better? Or was it, in effect, actually harming them?
Yeah, I believe it was harming them. The combination of remdesivir and being intubated, definitely, I mean, we're talking about
Sedatives.
And sedatives, setting them up, you know, I mean, these patients were many of them were isolated, not fed, not given enough fluids, isolated, kept from their family members, given medications that were, you know, they were already in respiratory stress, and then you give them sedatives and anxiolytics, you know, keep them from anxiety. It's gonna depress their respiratory drive further, and yes, and many of them were intubated and put on remdesivir. They had developed kidney failure from the remdesivir fairly quickly, and you know, 80% of these patients never made it home. And so this was not the way to treat them. There was other ways to treat them. You know, after having treated many very critically ill patients at home, I can tell you that you know, these alternative treatments, like with the Math Plus protocol, do work. And so yeah, I mean, I'm adamant that you know, we can never go down this road again where the FDA and the CDC and our politicians and big pharma and et cetera push protocols on us that not only don't work, but that actually harm, injure, and even kill patients. Yeah.
And do you have grandchildren?
We do. Yeah, we have 4 grandchildren and 2 on the way, all under 3 years of age.
That's right.
So
And
yeah.
so now, what are, you know, would you recommend to your child to vaccinate their grandchildren?
Well, I think they all know how we feel. I mean, I one of my greatest regrets is being ignorant and just saying whatever you say, doctor, when it came time to, because we've just grown up, you know, old enough to remember Marcus Welby, but that's not who's treating our patients today. I mean, they have been, you know, the patient and the doctor relationship has been corrupted so that it seems that many doctors are just going to follow the protocol that their insurance, their administration, their FDA and CDC, who are controlled by Big Pharma, dictate. And we were ignorant to that. But I think, I'm praying that our kids are heeding this warning, because that's one of the biggest regrets I have is ever taking a vaccine or allowing my son to be vaccinated.
Yeah. Yeah, we've definitely been talking to them and giving them books. And so.